Powered by data. Driven by innovation. The Zealie Mobile App is the behavioral healthcare industry's only mobile billing app that helps forecast revenue. With several key features, the Zealie Mobile App was designed to help increase revenue for substance abuse treatment centers. The multi-purpose app delivers all of your corporate financial data and analytics in the palm of your hand in the moments when you need it most with an easy-to-use interface. Now, let's take a look at all the features of the Zealie Mobile App. Facility Totals is a Zealie Mobile App feature that gives you information about every dollar you've billed since we've been keeping track for you. The Facility Totals feature is very easy to use. As you can see in this first line item, this facility has billed over $8 million. The next line item down tells you every claim that's adjudicated, gone through the cycle, got a payment, or denial. The next item on the list is Total Paid. This reflects the payments made on those adjudicated claims. Next, you can see the total percentage collected on those adjudicated claims. And the next line item are the unadjudicated claims, which is also known as your aging. The last line item for the Facility Totals feature is Additional Expected Revenue. To calculate this, we simply take the percentage collected on your adjudicated claims and multiply that by your unadjudicated claims. This gives you a rough estimate of your additional expected revenue on your outstanding claims. The Aging Report feature lets you know how long your unpaid claims have been outstanding. In this example, you can see that the total amount of unadjudicated claims on the far right is approximately $1,030,000. However, you can see that approximately $900,000 of that is less than 30 days old, so most of the aging are new claims. Census Mix, Revenue by Payer, and Payer Rates are three Zealie Mobile App features that work closely together. Census Mix is the feature that allows you to see which percentage of your claims are billed to each payer. This lets you know how much of your census is being occupied by each particular payer. As you can see, this facility billed approximately 36% of its claims to Anthem Blue Cross Blue Shield, making Anthem the largest payer, while Cigna only makes up approximately 17%. This information is important to track so you can see the quality and diversity of your census mix. As we will see later, just because a particular payer makes up a large portion of your census mix does not mean it will make up a significant portion of your revenue. Revenue by Payer lets you see how much of your revenue is actually being generated from insurance payments for each payer. In this example, we can see that Anthem Blue Cross Blue Shield makes up approximately 19% of this facility's revenue, while Cigna makes up approximately 30%. As we saw earlier, Anthem Blue Cross Blue Shield made up 36% of this facility's census, while Cigna only made up 17%, meaning that Cigna policies are likely paying significantly more for the same services than Anthem Blue Cross Blue Shield policies are. The Payer Rates feature will tell you what percentage you are getting paid by each payer for each dollar you bill them. Here you can see that for every dollar billed to Anthem Blue Cross Blue Shield, this facility is only getting reimbursed 21%, while for every dollar it's billing to Cigna, it's getting nearly 69%. This explains why Anthem Blue Cross Blue Shield makes up 36% of this facility's census, but only makes up 19% of their revenue, while Cigna makes up 17% of its census, but approximately 30% of its revenue. This facility is getting paid significantly more for each claim it bills to Cigna than to Anthem Blue Cross Blue Shield. That is why it's so important to be frequently monitoring your census mix. The Authorizations feature allows you to see all of the authorizations for the clients in your census. For demo purposes, these are all made-up names. There's no protected health information in here. When you access the mobile app, you'll see the data that belongs to your treatment center. On this first page, you'll see all of your active clients and when their next utilization review is due. If you want to look someone up, you can just type into the search bar at the top. Let's type in Sunshine. Here's Sunshine Smith. Click on Next You Are Due, which as you can see is on September 7th. The next screen then gives you all of her information, so it tells you when her next UR is due, all of her past URs, and her first authorization. As you can see here, her first authorization was for detox. It was for 5 days. Her second authorization was also for detox, and it was for 2 days. Her third authorization is 14 days of residential, and so on. So you can see all of her most up-to-date authorizations, and you can see when her next authorization is coming up. The Level of Care Averages feature lets you know how much you're getting paid by each payer for each level of care. It will also let you know how much authorization you're averaging per level of care. This feature is broken down by payer, the big ones first. Anthem, United, Aetna, and Cigna, and all other insurance carriers are put into one category. Here you simply click on a payer to find out how you're doing with that particular payer. For example, you can look at Cigna and see that this facility is averaging 22 days of authorization for residential care and averaging $2,317.98 per day. Patient data is the Zealie Mobile App feature that allows you to keep track of payments, not only for every patient that's currently in your census, but every patient who's ever been in your census. For demo purposes, these are all made-up names. There's no protected health information in here. When you access the mobile app, you'll see the data that belongs to your treatment center. To find a particular person, you can just type into the search field. In this example, let's say Rolando Castro. Click on the name, and as you can see, Rolando has an Aetna policy that is paying 75% of billed charges. Rolando has had approximately $56,000 in claims adjudicated. On those adjudicated claims, there's been about $42,000 in payments. He has about $8,000 in claims remaining. The additional expected revenue on those remaining claims is about $6,000. The total expected revenue is approximately $48,000. This feature makes it very easy to track every single patient's payments and expected payments. Alpha Tracker and Payer Tracker are two Zealie Mobile App features that work closely together. They serve as good admission tools that can help you make smart admission decisions, especially during off-business hours when you're unable to run a manual verification of benefits. Alpha Tracker is one of Zealie's smart admission tools. This feature is specifically designed for facilities that are out of network with Anthem Blue Cross Blue Shield. At Zealie, we've noticed that there's one data point on Anthem Blue Cross Blue Shield policies that seem to have the most influence on a facility's potential out-of-network reimbursement, and that's the Alpha prefix listed on the patient's insurance ID. To use Alpha Tracker, you would just type in the Alpha prefix from the patient's ID. This will pull up any historical data we may have on that Alpha prefix. For demo purposes, these are all made-up names. There's no protected health information in here. When you access the mobile app, you'll see the data that belongs to your treatment center. For this sample search, let's type in the Alpha prefix BGD. Click on BGD and you'll see approximately $196,000 worth of data on this Alpha prefix. Historically, this Alpha prefix has allowed 98% of billed charges. It also lists the average payments our clients have gotten for each level of care. This is important because we've noticed that certain policies have great benefits for some levels of care while having terrible benefits for other levels of care. Payer Tracker is just like Alpha Tracker, except it's designed to aggregate historical data for small insurance carriers. This is important because often you can come across an insurance policy that you've never heard of before. Therefore, you have no indication of what its potential reimbursement rates are. For example, let's type in Silver Networks Insurance and then click on the name. As you can see, we have about $126,000 of data on this insurance policy, and this policy has historically allowed 54% of billed charges. However, as you can see, this particular policy has very good benefits when it comes to detox and residential treatment center levels of care, but not so much when it comes to the PHP and IOP levels. Zealie Check is a cloud-based 24/7 electronic verification of benefits feature that allows providers the ability to check a patient's insurance coverage by submitting basic patient information electronically and getting verification results back instantly. It is available via Zealie's desktop and mobile app and comes free for Zealie customers. This tool is great when used with other Zealie tools such as Alpha Tracker and Payer Tracker, and it's great for evenings and weekends when you're unable to run a manual VOB. For demo purposes, we'll use the name John Doe. Now there's no protected health information in here. So to check benefits, you'll start by filling out the fields on the screen. You'll type in the first name, last name, date of birth, the client's member ID number, and the insurance carrier. You'll have access to over 500 payers with Zealie Check. First, you'll type in John in the first name field, Doe in the last name field, the patient's date of birth, their member ID, and their insurance carrier. Then click Verify. Our system will make a call to the payer's database. Now it's going to take a few seconds to get this data from the payer back to the mobile application. Then go to Coverage Status. Now, if you don't see the name you just entered, just click Update. As you can see, John Doe is here. Click on his name. The next screen will give you his basic information, his member ID, insurance carrier, and plan type. Then scroll down, and you can see his out-of-network and in-network coverages. And you can see if the policy covers the services you provide. So let's start with the out-of-network coverages. The app will give you the client's deductible and how much has been met. Then there's the family deductible and how much has been met. The client has substance abuse out-of-network benefits. You can also see the client's coinsurance and their benefits for alcoholism and drug addiction. Then scroll down to the client's in-network benefits. Here you'll see what the client's in-network deductible is and how much has been met. Then their in-network out-of-pocket expense and if they have substance abuse and alcoholism coverages. Request a free and personalized demo of the Zealie Mobile App by visiting zealie.com/demo.